Hello, I'm Dr. Andrew Neville, specialist in adrenal fatigue. I often get asked the question, why doesn't my doctor believe in adrenal fatigue? And it's a fantastic question. It's basically goes back to the way conventional medicine is taught, right? In med school, what conventional doctors are taught is that if your adrenals are functioning at all, like if you haven't had complete failure of your adrenals, right, which is a very rare condition called Addison's disease, right? If your adrenals are functioning at all and they haven't completely failed, then they're working just fine. Now, there's a couple other kind of quirky little adrenal issues like Cushing's disease or pheochromocytoma, things like that, but those are even more rare. But the idea is if your adrenals are functioning at all, they're functioning just fine. That's what they're taught. So they'll do a test, right, to rule out the fact that your adrenals are functioning at all, right? Whether that's just a straight blood cortisol test, which almost always comes back normal, maybe low normal, but they don't care about that, right? Normal. Or maybe they'll even do a stim test, right? Which is where you inject a synthetic version of the pituitary hormone, right? That stimulates the adrenals to release cortisol. You inject that. And again, unless your adrenals have completely failed, they will respond to that, right? But that's not what adrenal fatigue is. Adrenal fatigue is not flat out failure. Adrenal fatigue is more dysfunction within the adrenal glands. Even if we think about this logically, you have three main endocrine glands controlled by your hypothalamus and your pituitary, right? Your adrenals, reproductive organs, right? So ovaries, and your thyroid. Well, in conventional wisdom, conventional medicine, you're allowed to have a thyroid problem short of complete failure. You're allowed to have an ovarian hormone problem short of complete failure. But if your adrenals are functioning at all, nope, they're perfectly fine. I mean, it just doesn't make logical sense. And nothing can be further from the truth. So if we're looking at these conditions of the adrenal gland, we put everything on a kind of a bell curve, right? This continuum. You've got kind of Addison's disease, which is complete failure, way over here. You've got Cushing's disease, which is an overstimulation, way over here. And then if you don't have any of those, everything's fine. Well, optimal function, I can promise you, is much tighter. And if you look at the symptoms even of adrenal fatigue, you'll see the symptoms are almost identical to that of Addison's, even similar to that of Cushing's at times. Right, almost identical, just not quite as severe. Now, if we're going to split hairs, just short of Addison's, which is a complete failure, you can have something called adrenal insufficiency. Adrenals, now that's an official ICD-10 diagnostic kind of category or condition. It could be primary or secondary, whether they think it's just the adrenal or is it secondary, meaning it's the pituitary, right? That's also an official diagnosis. Again, I have patients in my practice who have been diagnosed with these conditions, but they're incredibly rare. The vast majority of my patients do not have failure or official insufficiency. They have adrenal fatigue, which is really just suboptimal or dysfunctional adrenal function, which is not ultimately just a problem with the adrenals, because the adrenals are part of this bigger system. And this is tough, right? Because in conventional medicine, we're really good at what we call reductionist thinking, right? Kind of boiling things down to the smallest detail that we can and trying to pinpoint what's going on. I am much more a generalist with regard to this, right? So if we think about the adrenals, if I'm suggesting that there's a problem with them, well, the adrenals don't decide whether or not to release the stress hormone, right? Cortisol, adrenaline. That's the hormone that causes all the damage. Life-saving once in a while. Too much of it, tons of damage. The adrenals don't decide to release that hormone. So if there's an adrenal problem, there's got to be a problem with whoever yells at your adrenals. Go up the chain of command, we hit the pituitary, right? And the hypothalamus. These are two endocrine glands, right? Hormone-producing glands. They live in your brain. Now they also control, the hypothalamus, pituitary also control your thyroid and your ovaries. And if the adrenals go south, it's going to drag down those other two as well. I imagine I'll talk about that in some other video as well. Now, this is a problem not just with your adrenals. Now it's your whole HPA axis, right? The hormones But it doesn't even stop there, because the puppet master of this thing, the CEO of your stress response, is the limbic system in the brain, a deep central part of the brain whose job is to constantly assess your environment for danger. So now what we've got is not just adrenal fatigue, we've got a problem with the hormone side, there's even a nerve side of your stress response, and that limbic system in the brain. Together, this makes up what I would call, more accurately, a stress response system dysfunction, which is what adrenal fatigue actually is.